So how many of you want to feel sick, fat, and old? Well, me neither. But that's what's happening to a lot of Americans these days. We're getting sicker, we're on more prescription medicines, we're spending a lot of money on our healthcare system. We spend more money on our healthcare system than any other country on the planet. And yet, as a nation, we're only ranked number 38 in terms of healthcare outcomes. So something is wrong. I mean, do you agree that we have a healthcare crisis in America today? In the last few years, we've spent a lot of time debating how we're going to pay for our healthcare system. We even have new laws in place. But I really feel like we've missed the boat. I feel like we should have had a different debate. I feel like what we should have been debating is what kind of healthcare we're going to be providing, not just how we're going to be paying for it. When I went to medical school, I was trained to prescribe drugs. If your cholesterol's up, we got a pill for that. If you don't sleep, we got a pill for that. If your blood pressure's up, you get the point, right? And then the next thing you know is you need drugs for the side effects of the first drugs. And really, those drugs aren't fixing anything, because what happens if you forget to take your blood pressure pill? Your blood pressure just goes right back up again, right? And how long do you need to take your cholesterol medicine? Forever, right? So something is just really not right. Another thing that I was trained to do is divide you into pieces. And we're supposed to think about you one piece at a time. And that's why we've got one doctor for your kidneys, and one doctor for your heart, and one doctor for your skin. But that's not how your body works, right? Those pieces don't work independently. We're a whole system. And so a holistic approach just makes so much more sense. What we are really good at in modern medicine is crisis medicine. So if you have an acute infection, if you need emergency surgery, well, this is a great place to be. We can take care of those things. Unfortunately, though, our modern healthcare system is not so suited to looking after chronic conditions, which is what the majority of Americans are suffering with. We don't have a cure for heart disease or Alzheimer's or cancer. So really your best bet is to do what you can do not to get those in the first place. I mean, do you agree? So here's how we're different. The way that we practice medicine is considered integrative medicine. And what that means is we take the best of natural medicine, we take the best of conventional medicine and the best of natural medicine, but we start with the natural things first, wherever that's appropriate, and we save the prescription drugs more as the last resort, instead of automatically turning to them as the first step, which is how I was trained. The approach that we use is considered functional medicine. And what that means is we're evaluating how your body is functioning, and we're looking for things that may not be working quite so well, and we want to correct those things, bring things back into balance so that your symptoms go away, and then hopefully you don't need all of those prescription drugs. At Signature Wellness, our special area of interest is hormone balance. So let's take a few minutes to talk a little bit about hormones. Hormones are chemical messengers. They give your cells information. They tell your cells what to do. So for any of your hormones, if you have too much, your cells are going to get the wrong information. And if you don't have enough, your cells are going to get the wrong information. So for all the hormones, there's a window of optimal function that we're looking for. Sometimes one hormone is converted into the next one and into the next one and on down the line. So if there's a problem with one hormone, it ends up causing problems with the downstream hormones. Sometimes one hormone has equal and opposite actions to another. So if one is high normal and one is low normal, technically they're both normal, but there's an imbalance there and you can have symptoms. So if we can bring them back into balance, the symptoms go away.